Linda Harden is an energetic mom who makes it to the gym daily, but it wasn't always like this for Linda.
After I had my twins, and they're 9 now, everything hit bottom. My anxiety attacks came on, panic attacks, and I knew it wasn't just in my head.
Linda talked to her doctor but got nowhere.
OBGYN, went to him first. I thought I was having a nervous breakdown, just didn't understand what was going on. He told me, here's an antidepressant, go talk to somebody.
Linda says the negative feelings didn't go away.
That was not the answer, and I knew that.
Linda began reading and researching, finding out about bioidentical hormones. Her research eventually led her to Dr. Eldred Taylor, an expert on the subject.
He got me back on track.
I hear this story all the time. A 35, 40-year-old woman who complains of hormone-type issues and adrenal-type issues with the stress and the anxiety.
Dr. Taylor is an accomplished speaker and author on bioidentical hormones, and in no time, he helped Linda get back to her old self.
Probably within the first 2 months. My kids would notice things that I was doing. They said, whatever you're doing, keep doing it.
What Dr. Taylor did was measure Linda's hormones using a saliva testing kit for more precise results than a blood test.
If you're going to balance something, you've got to be able to measure it. You've got to measure it appropriately, and hormones, fat-soluble hormones, are not measured appropriately in the blood. You need to measure it in the saliva. You have to measure the hormones, you balance them, and now all of those 10 or 15 symptoms go away just by balancing those basic hormones.
Dr. Taylor actually had a very personal reason for researching bioidentical hormones. His wife, Dr. Ava Bell Taylor, began experiencing similar problems right after giving birth to their youngest child.
Shortly after that, I began experiencing mood swings, anxiety, insomnia, and I just felt like I'd lost my edge.
She asked her husband to look into bioidentical hormones. Though reluctant, Dr. Taylor finally listened to a tape about bioidentical hormones, and from that tape, he was determined to find out everything he could on the subject. His wife was his first patient.
I tested myself, and I tested my female hormones and also my adrenal hormones as well. And of course, they were just wacky. I mean, they were totally out of balance, and from there, my husband prescribed a progesterone cream, and almost immediately my symptoms just improved. I was sleeping, I was calm, the severe PMS was much better.
Through treating his wife, Dr. Taylor changed his approach to medicine altogether.
Now, what I try to do in a patient is try to identify the abnormal physiology and to try and correct the physiology. Where I was really taught to listen to the symptoms and then find a pharmaceutical or a drug answer to cover up the symptoms and not really involve myself in trying to fix what may be the underlying source of the problem.
Traditional hormone treatments have a one-size-fits-all approach. They use a patented formula that's given to every patient. Bioidentical hormone replacement uses the hormones progesterone and estrogen. Since they are naturally occurring, they can't be patented.
It's like trying to fix a Ford with a Nissan carburetor. It just doesn't work in everybody. One size doesn't fit all. So you have to figure out what that particular person needs, and you have to replace it with exactly the same hormone that is deficient. Money makes the world go round, and no one is going to put a lot of money in research if they don't think that they're going to be able to exclusively benefit from it.
Now the Taylors are bringing their knowledge and research to others, educating both doctors and patients.
As we became more and more comfortable and knowledgeable about bioidentical hormone replacement, we began to write newsletters, which led to a book, Are Your Hormones Making You Sick? Because we felt that there was a tremendous need out there for women to become educated about their options regarding hormone therapy. Women have not been given the full story regarding hormone replacement, so our job and our mission is to put all the information out there regarding bioidentical hormone replacement and synthetic hormone replacement, and so that they can make the best choice for themselves.
I'm out trying to educate doctors about this information so that we can change the standard of care by getting more reasonable physicians to think in this more physiologic, holistic type manner.
Linda Harden is also on a mission. She doesn't want other women to suffer for years like she did.
What is it going to hurt them to do a saliva test? Nothing. You know, it may cost you a little bit of money. It's not a lot. It's worth that investment for your sanity and just for yourself. I mean, you do it for other things, your hair, your nails, whatever. Do it for your health.